my lovelies. My name is Lecka, and today we are going to be watching Season 1, Episode 3 of Botched, which is titled Vagina Bomb! Which is quite the title, but this one's going to be all about labiaplasties and specifically a sex worker in the adult film industry who is wanting to get some work done on her vagina to make her feel happier with her body. And of course there's going to be some other people in here too, but that's going to be the main premise of it. So if you guys are excited for today's video, go ahead and pre-like the video so that we are freaking roaring and ready to go, and you don't forget to do it. And if you missed out on the other 2 episodes of Botch that we have watched previously, go ahead and click on the eye icon here in the top right hand corner of the video, and you will be taken to the other videos to go watch and support those as well. If you guys have been enjoying my content so far, make sure that you subscribe so that you don't miss out on any of the shenanigans that we do. But I will be recording and reacting to Botched, and hopefully to another one if I can find a way to get it to work. We'll be adding another series to the channel here soon that I'm really excited for as well, so you guys can stay tuned. But for now, let's go ahead and watch Vagina Bomb. God, her boobs look good.
23, I had 24 plastic
Damn!
surgeries.
That's a lot of plastic surgery.
Natural.
Is that possible? I had this metal wire.
There's literally thread coming out of her
We don't
nose.
know what it's connected to.
What the heck did you
Oh my
do?
god.
It's in the top 10
Again,
of
I
the
can't
worst
show
heated
that part
symptoms that I've
because
seen.
there's blood.
Completely devastated.
This is my
Look at her ass!
backwards.
Wow, it's so flat.
Up underneath my cheek, it just flipped.
Oh my
Do
god.
you mind if I lift this up?
It's all over the internet. Go ahead.
Renee's buttock is gone to
I wanna be sexy.
I wanna be hot. Fix me, make me beautiful. You just vogue during the intro. I wanna be perfect. Such an iconic theme song for this plastic surgery reality TV show.
I'm Kimber James.
Kimber James.
And by the age of
God, her tits are amazing. I want tits like hers.
23, I had 24 plastic
That's so
surgeries.
many. By 23, she had 24
I've had
surgeries?
2 brow lifts, 2 brow bone shavings, hairline reduction, 4 rhinoplasties, my ears pinned back, an upper lip lift, a lower lip reduction, a jaw reduction, chin shaved down twice, lower neck lift, neck lipo, a tracheal shave, 5 breast surgeries. 3 were augmentations, 2 were corrected.
Oh
I
my
definitely
god!
look back and think I really shouldn't have done a lot of the surgeries I've done, but I got caught
Wow, her
up,
boobs look good though.
and I just probably went a bit too far.
Okay, so she, oh my god. Holy crap, she had 24 surgeries by the time she was 23. It's not the fact that she had 24 surgeries, which is a lot of surgeries, but she is also trans, and so it makes sense because she was saying she had the tracheal shave, she had a lot of facial procedures done for facial feminization surgery to make her face appear more feminine in the way that she wanted to be more aligned with her she is as a person. But it's the fact that she got them done in such a short amount of time. It takes months and months and months to recover from a surgery. So you can go under and get a few procedures done at once, but you can't go under and get 24 procedures done at the same time. That means that she had to go in for surgery and was probably getting surgeries done, maybe even multiple surgeries done at once, so that she could, you know, pay less in anesthesia costs and just get multiple done in one whack. I'm not sure if that's true or not, but I would guess that that's likely what she had done. Probably 2 or 3 months after the first surgeries were completed, which does not give her body time to recover the way she needs to. And with her being a porn star as well, that means that she couldn't take a lot of time off of work to recover from these because she has to be back on set, naked, having sex, performing, right, to make her money. So she not only wasn't able to have a lot of time to recover from it, but she's also having to have the pressure of, you literally can't have clothes to hide your scars on your body. You can't have clothes on when you're a porn star to cover up things that are still healing. You have to either cover it up with makeup, or you have to rely on the editing team when they edit the video to then post it to whatever sites it is that they want to, which is really hard because you should not be putting makeup on still healing wounds, because they're still healing. So I imagine that probably a lot of her surgeries have not gone as well as she would have wanted because she wasn't able to give them the time to recover post-operatively that she needed to. That's a lot for Kimber here to deal with. And now she was having a breast augmentation when she was 17. That's, her body wasn't even done developing at 17.
Started with breast augmentation.
God, her tits look good,
when I was
though.
17. I've had issues every single
That
time.
sucks.
And now
Ripple.
I'm just ripple
Yeah,
central.
it's a lot of rippling.
Everyone knows
That's
I've had
not
a nose
saline.
job the minute they look at my face.
She,
You just look expensive.
But
it
I
is
wanna
small
look
and turned up.
natural.
Is that possible?
At 15,
like,
I had my
much
first
higher.
nose job, totally
Yep.
botched, and now I've had 3 more to correct it. And I'm
that
still
one
not
looks
happy,
okay.
and it's
but
not just because
is
I'm not
higher up.
satisfied. It's a mess. I've had to take
And her
cartilage
nostrils
from
are
both
asymmetric.
ears to repair. I can't really breathe that well. It's why I sound so nasal.
If she can't breathe well,
I
too,
hate
that's
when
just a
people make
physical
nasty
issue, not just a
comments.
cosmetic
I'm
one.
over it. I feel like I'm just a walking mistake.
No, she's not.
I want to be more natural. I want to be more toned down. I want to feel more like a woman and look more like a woman.
You look expensive.
I had my sex change a year.
Good
and a
for
half
her.
ago.
Trans rights and
I
human
told him I
rights.
wanted to look like I was 13 and never been touched.
That is
before.
unrealistic
My
as
vagina looks like a baseball glove. I was the first transsexual to sign with an adult
Good for her.
agency, but I'm
I think there's a
really
lot
at the
more
point now where I'm
transgender
working
people
my
in
way out
porn
of
now.
porn. It's time for me to move on.
Yeah, but it's
I
not
don't
something you can stay
understand
in
how you
forever.
have a virginal-looking vagina after all the damage it's seen.
Why'd you have a good time?
I feel like the doctor gave me no inner lip. He only gave me
only
outer,
outer
and
lip.
the outer lips are not tight. They hang too low. It doesn't look like a vagina to me. I really
Interesting.
feel like once
So,
this
for
is
those
done,
of you guys who don't know, I'm sure almost all of you either have seen a vagina before or have one yourself and know what it looks like. In a natural AFAB body that is born with a vagina, you have the outer lips of the labia, which are not the ones that hang down, that people call meat curtains. That's your inner labia. Those are your inner lips. And those are of all different lengths and sizes. Some people's are shorter and they don't hang down as much. Some people have really long inner lips and they have longer labia, and that's just the way it is. It's there's the outer lips that's more plump. You can kind of just think of it as, instead of hanging down, it's just a raised hill sort of thing on either side of the vagina. And then you have the inner labia, which are the more flappy curtain parts of the labia. And then, of course, inside of the inner labia, you have the vagina at the bottom, and you have the clitoris and urethra at the top. So when you are going from male to female anatomy, when you're having a sex change, when you're transgender like this, it's really hard to replicate that anatomy from turning the penis tissue into something that looks like what a natural vagina does. So she was saying that she doesn't really have any inner lips, so it sounds like they weren't able to give her those inner curtains that she was looking for. And obviously I don't know what it looks like, and we're not gonna fucking show it, even if they do show us her vagina. I'm not gonna show that on YouTube because demonetized immediately. But it sounds like the person may not have had a lot of experience with sex change surgeries for transgender people in the past and didn't give her the result that she was wanting. She was wanting something very unrealistic, and that should have been tempered at the appointment as well. She's not going to get a virginal looking pussy. Like, that's just not realistic. And plus, what she's wanting when she describes that is something that is very tight. Usually it's where it's the outer lips and you have the inner lips as well that are very, very, very short. So she would want a labiaplasty to mimic having the inner and outer labia, but have it be much more tucked into the folds of the outer labia so that it's easier to see her vagina and clitoris without needing to spread apart the inner labia in order to see them, because the inner labia, depending on the length of your inner labia, can hide those parts. And in her job, where you need to have everything, spread eagle and open, it probably makes sense for her to do that. She did say she wants to get out of sex work. Totally valid. It's really, really hard to be a sex worker, and that's not something that she wants to do for the rest of her life. But it's not uncommon for people who are transgender to get into porn, whether it's on OnlyFans or whether it's with an actual agency like she was able to get signed to, in order to pay for the surgeries that they need to get their gender-affirming surgeries paid for. Because if you don't live in a state like Oregon, for example, where transgender surgeries are covered by the state for gender affirmation, you have to pay for it out of pocket, right? And it's extremely expensive, especially when you have 24 plus procedures done, whether it's sex change and facial feminization or facial masculinization, whichever gender you are transitioning into. It's a lot. It's a lot of surgery. It's a lot of recovery time. It's a lot of work. It's a lot of money, specifically. So I'm very interested in seeing how this is going to work out for Kimber.
No more plastic surgery.
I'm really hoping so.
I just want to make
And she has
a
an end goal.
normal guy, have the white
She's so
picket
hot!
fence, but I don't necessarily think it will really happen for me.
He can.
I think I come with a lot of baggage.
Everybody comes with a lot of baggage, babe. There's somebody out there for everyone. That doesn't mean that you can't find the man
The
of your
next patient
dreams.
is Kimber James, who is a transgender from male to female. She needs a revision of her nose, which is she's had multiple
Her nose does
surgeries.
need
I'm
fixed.
gonna
It's
do,
turned up way
with
too
your
high.
help, a revision of her breasts, and then she looks
Dr.
like she has
Gary
a
Alter.
complicated vaginal labial reconstructive
Yep.
need, right?
Correct.
Yeah. In a very complicated case like this, we need to bring in a world's expert. Dr. Alter basically is the wizard of vaginas. He's a vagina.
Vagina whisperer. I don't know
Have
if
you
I
ever
would want
done
that on my resume, but
transgender
here we go.
Male to female surgery.
Imagine being
Do
a
you have to
vagina whisperer
learn
on TV.
How to fake an orgasm, the way my wife does.
Jesus Christ.
Terry has a subtle penis syndrome.
That's better than micro penis syndrome.
I mean, that is kind of funny, but that just shows a level of lack of knowledge on Dr. Dubrow's part of the anatomy and way that people who have sex change surgeries experience their bodies. Just because you go from, in Kimber's case, male to female with your surgery doesn't mean that you can't have orgasms and you can't experience pleasure during sex. You still have the same nerves of the penis. They just basically break down the penis and turn it inside out and give you the labia, the clitoris, and all of that you need, because the most of your nerves are at the tip of your penis. So that is the closest part on a penis to a clitoris. The clitoris has, I think it was like 5 times more nerve endings than a penis tip does, which is why clitorises are so sensitive, and why most women orgasm from clitoral stimulation rather than penetrative during sex. But that doesn't mean that they can't take and save the nerves that are at the tip of the penis when they're doing the surgery and convert them into a clitoris for the patient, so that they can still have and experience and enjoy stimulation from sex, just like somebody who's AFAB, that's cisgender, would. And it doesn't mean that they are completely numb down there and it's only there for looks. If the surgeon did it correctly, and it sounds like Gary Alter, the doctor that they brought in to help Kimber with specifically her vaginal needs, is going to be an expert in this field specifically and will give her what she's looking for. So it doesn't mean that if you have a sex change, you can never feel good or experience sex again and you have to forego ever having pleasure with sex. That is not true. Transgender people, if they are not asexual, can in fact enjoy and have fun with sex after their surgery.
Hi, Kimber.
Hi, how are you?
Good.
Terry Dubrow, nice to meet
Hi.
you. I'm not familiar with Kimber James's work. I bet you Paul is.
This is Dr. Alter. Nice to
Hi,
meet
Everybody
you.
watches porn.
Who's this?
Not
young
a
lady?
big
This
deal.
is my best friend Danielle.
Danielle!
So we've been talking about you behind your back, obviously, in a positive way. And we've been talking about all 3 different types of surgeries, from the
I
nose
love her hat.
to the breasts, and then down in the vaginal region.
Right.
Start off with your breasts.
Well, I've had 5 surgeries.
Quite a few surgeries.
Now I'm 1,000 cc's.
1,000 cc's is like 2
1,000
quarts of milk, right?
cc's?
Pay every day for it.
So now you feel
Wow,
like
I am 6'25",
Yeah, I mean, like, I'd like to
and
go
I am a
down
G
to,
cup,
800.
by the way.
Right.
When we get a patient that has had
Wow.
many plastic surgeries and
That's a
gone
lot.
to the
That's a
extreme,
lot.
it's usually a red flag for us.
But she's
But in
transgender.
Kimber's case, she's asking us to make her look more natural. So that's something we're okay
Yeah,
with.
she's not trying to go
What's going
bigger.
on
She
with
wants to
your
go
nose?
down
It
to like
just looks
D's,
very-
double D's maybe.
Nose jobby. It looks like it's a fake
It does.
nose.
It looks
When
very
you
altered.
overdo a
It's,
nose and take out too much tip
it looks
cartilage,
not natural at all.
the tip starts to shorten and lift back. It loses
It's like a
projection,
pig nose.
and the nostrils get really retracted or pulled back. This is
like
a
she's been
sign
smashed.
of over-aggressive surgery. But now for our final part.
Vagina!
So right now, what bothers you?
I'd rather it be tighter, more virginal.
That's
looking.
unrealistic.
Well, that is a
Yeah,
little
thank you.
nuts.
Thank you for setting her straight.
Plus, we have videos.
Well, I mean, there's that too.
But,
Danielle has the perfect vagina.
But how she had a
and I
labiaplasty.
want hers. As close as we can get to it. So, twin vaginas.
What the actual did Danielle, did the fucking friend of, I get she's a porn star as well. I get she's also in porn, but like, you don't flash your vag to doctors. That is inappropriate as shit. You're not on set. You are in a doctor's office in a professional setting. You need to act appropriately, respectfully, and you are not respecting any of the doctors. It doesn't matter if they are, if Dr. Gary Alter is a vagina whisperer. he still doesn't want to be flashed a vagina unless he's looking at it in a clinical setting to figure out the anatomy of what he has to cut and nip in order to get it to look the way that he wants to give you an improvement of what you're looking for. He doesn't need to see somebody flash their vagina to them. She really wanted it to be very similar to her friend's vagina, instead of this happening, which this was probably for TV, and they were like, oh, I'm on TV, let me flash my vag, which, whatever. It's very classless and disrespectful, for one, and not appropriate whatsoever. But they could have taken a picture of her vagina and sent it to Gary Alter, Dr. Gary Alter, and said, I want it to look as similar to this as possible. For example, the inner lips need to be smaller. The outer lips I want to be plump but looking XYZ. I want it to look like, you know, whatever, right? So this was just inappropriate in every single way.
I know what a
Well, yeah.
vagina looks like.
It's not necessary.
Well, you don't think I should go with that one?
Yeah. Good.
Jesus. No one!
We need to examine you.
Gotcha.
Oh my god. If this wasn't on a TV show, they would have been rejected as patients for doing something
That's my
like
little
that.
medical team. I'm not having the surgeries to better my career. I'm having the surgeries to better
And that's why you
myself.
should get
I
surgery,
don't
is
want
for
people to
you
stare at
and
me
not for
on the
anybody
street.
else, or
I
for a
just
job, or for anything.
want to calm things down.
Okay.
She's so
the biggest
beautiful.
issue with operating on Kimber's nose is the elasticity of the skin. There's not a lot of movement.
He looks really sharp in that
Now,
jacket.
the thing is,
I like
so
it.
we're not going to hit a home run on this. This is going to be a double or triple.
No Michael Jackson.
You know,
possibly.
no Michael.
Okay.
No, better not be.
I've been to countless.
They're probably gonna have
amounts
to
of
take
plastic
rib.
surgeons that have just said absolutely nothing can be done. I'm in complete and utter shock that Dr. Nassif can give me any hope of any improvement.
Any improvement is better
So,
than none.
Let's take a look at the chest area. Okay, so, you know, the first thing that stands out to
The
me
rippling
is
in the middle.
that they're very large.
They are,
right?
and
Sends
they're
out
so
to
large,
everyone.
you can see
Right.
the ripples of
And
the saline.
you can see the
Yep.
saline bag, the ripples. We call
That's
that
why you always go
wrinkling
with
or
silicone,
rippling,
guys.
right?
Don't use saline.
So,
They're old and
you want to
antiquated.
improve
Use
that.
silicone
My
if you're getting a
plan,
breast
if
implant
it
done.
sounds okay to you, would be I put a smaller pair of silicones in and close up the pocket around them and try to improve the shape.
Okay.
Saline
that's
is
a good one.
essentially salt water. It's a water bag. You can feel the water in there. Silicone is a gel-like material that looks and feels like an actual breast. So silicone is almost always preferred in patients.
Even if you're wanting the
I think
bimbo stuck-on
that'll
look like I have one
hit
to
a lot
get,
of goals. So last
silicone's
but
still
not
the way to go.
least,
Dr. Alter.
So I make a little incision here, and here's your clitoris. So if I can cover that up a little bit more like so it's not as obvious.
Ah, give her a
okay?
clitoral hood.
The normal anatomy
here we
of the
go.
vagina is that you have
Yep.
outer lips,
Yep.
inner lips, a clitoris,
top.
and a clitoral
Yep.
hood. In Kimber's case,
And the
she doesn't
vagina in
have
the middle.
inner lips, nor does she have a clitoral hood. Dr. Alter is going to make her inner lips here and here.
Nice.
And create
And create a
clitoral
hood.
to cover her exposed clitoris. This will give her a more natural appearing female vagina. Are
That's
you
excellent.
excited about this plan?
The fact that
I'm
her
so
clitoris was
excited.
exposed is
After
kind
I
of
have
wild.
all these surgeries and I'm fully recovered, I'm gonna go out there and I'm gonna find my simple southern man,
man.
have my 3 children, and call it a day. And you can say goodbye to thee.
Hey, titties. Bye. Her titties look really good, but I understand she wants them smaller.
Is it on record? Good, okay. This is my implant flipping backwards.
Oh
name is
my
Renee
god.
Talley. My video has been seen in every country in the world. I think it was 1 million views in like 5 minutes.
Sticking implant's supposed to do that.
Holy
I started
shit.
altering my butt area in 2010. I went through like a little midlife crisis.
I mean,
and
I've had a BBL.
I wanted the volume and the fullness.
Ooh, I
back
love
at
her,
the top of my butt. I did the silicone injections.
Dermals,
Approximately
her dermals.
6 months after I had them done,
Piercings.
I started getting sick. I was having really bad fatigue. I had a lot of
That
pain and
ass does look good,
sensitivity
though.
in my butt. I was having stomach issues and bathroom
Oh,
problems,
no.
and it progressively got
Beautiful
worse.
eyes. Oh my god, her ass looks
They did
terrible.
an MRI to find out where the silicone was, and it had migrated up my back and down my legs, down my thighs.
Oh my god, it migrated.
And it can attach to organs and cause autoimmune disease. And that's what happened to me.
Holy shit.
I found a doctor that was willing to do the removal. He had informed
Wow.
me that I would have some, some
Well,
deformities
yeah, of
where
course
they
you
have
are.
to go in and cut out the silicone because they have to cut out the tissue
Right.
with it. And me being vain, I didn't want that.
No,
I decided
no,
to put an implant in to
no.
fit.
Okay, if you have had surgery. I don't care if it's a BBL, I don't care if it's implants, which, by the way, butt implants are a terrible fucking idea. If you want a bigger butt, BBL is the better way to go. Because implants, you sit on that area all the time. You put pressure on that area all the fucking time. It has a higher chance of rupturing. It has a higher chance of tearing. It has a higher chance of getting fucked up and causing problems like she was having with it rupturing and the silicone migrating throughout her body and causing her pain, autoimmune disease, constipation, like all these horrible, horrible things because of the silicone rupture that she had in her butt implants. BBL, they take fat, they liposuction you, like what I did was I had liposuction from my stomach, and they filled up my ass, and I just said to fill it as much as it could possibly go, and I think they put like 1,000 cc's of fat, because I was a big girl, all right? I'm still on a weight loss journey. I'm like 195 pounds now, but I was like 200 pounds, so they took, over 200 pounds, so they took more out, but I had a lot of fat, all right, that they could move to other places, and so they put 1,000 cc's in, but you have to remember only about 60% of that fat is going to stay. So your butt, when you come out of surgery, is going to be huge if you get a BBL, but it's going to go down. It is not going to stay that size. It will continue to shrink as some of the fat that they have not migrated, but injected into the site actually takes and stays, while the rest of it gets redispersed back into your body and taken away by your body doing its job and taking away things that don't stick. So that is why a BBL is superior to it. And with these, just like any other silicone things, like if you get silicone breast implants, you can't go more than 10 years without needing to replace these. With a BBL, there's no implants. It's your own body's fat that's just been moved from an undesirable place, like your stomach or your arms or your thighs, to a place you do want it, like your butt. So I'm really happy with the size of my butt. Once I actually lose the weight and get back to my goal weight that I want to be of 135, I am 5'9" or 175 centimeters, for those of you who are wondering. I will hopefully have my butt be way more prominent, because it's okay right now, but I'm so fat that you can't really appreciate the vavavoom that I'm going for, the very like bimbo-y, plasticky look that I really like for boobs and butt and hourglass, right? That's what I want for my body. That's the aesthetic that I want to get. And when I'm at my goal weight, I think that will be a big difference. I always thought about getting a second BBL, and then I realized that if I just lose the weight that I have right now, my BBL won't change. I will never lose weight in my butt, because the fat that is there stays there forever. So no matter how much weight I lose, my ass is going to stay the same size. So if I can make the rest of my body skinnier and more hourglass just by losing the weight and becoming healthier, my ass is going to just look way better, even though it's staying the exact same size, because everything around it will be smaller and therefore make it appear bigger and more prominent, which is what I want. So it depends on what your goals are. No matter what your goals are, though, never get butt implants, for the love of fucking God. Please do not.
Still in the space where
so she got them in to replace the silicone.
Wait 6 months, and I said no.
6 months?
Immediately after surgery, I noticed there was a problem. I could stick my hand underneath my butt, and I could
they
feel them,
dropped.
which was
They dropped.
Not comfortable. They had dropped, and I was, showing my girlfriend. And I went to pull the implant up, just underneath my cheek.
God!
It just
You
flipped.
should be able to flip
I
an
knew I needed to
implant.
have it removed, so I found another doctor to take it out. He said
Oh my
that
God, look
the
at that
doctor
ass.
should have never put the implant in.
Wow, no, they definitely should have. So this is the curve of where her normal butt is, right? Of the curvature of her butt. And this is where the implant dropped. The implant is supposed to be up here, right? It's supposed to be giving more projection. It's supposed to be giving more roundness to the booty. But the fact that it was not able to stay in place, which is another problem with implants, is your butt is very mobile. It's very fatty tissue. It's basically all fat. There's no muscles really in your butt that is on the cosmetic portion of the outer side, right, that we see, that we value for the humps and everything, to keep an implant in place. So you have a very high chance of it dropping, flipping, rupturing, just so many things going wrong and them not staying in place, because there's really nothing to support the implant to stay in its position.
And after removing tissue,
that looks so bad. That has to be painful.
Oh,
Oh, her butt's so flat. It's like a pancake, a droopy pancake.
Procedure has affected
Wow,
my
that doesn't
life
look good.
in so many different
Her dermals
ways.
are cute,
I don't
though.
really look in the mirror at myself anymore because I'm not happy with the way my butt
I get it,
looks.
girly.
It's something I did to myself, so I'm gonna have to learn to live with it. I'm
Oh,
probably
wow.
never gonna be able to fix the
It, like, goes down
imperfection.
and in like an
Once
S.
you ruin it, you can't go back and fix it.
Damn. What they can do is they can either do a BBL, I mean, that's really all they can do is remove the implants and then replace the
I'm Renee Talley.
empty
I'm here for
cavity
doctors.
with fat from the rest of her body.
Renee is a
She's kind of thin
patient
though, so she really doesn't
with
have a lot of fat
complicated buttock
to
implant
move
problems.
to other parts of her
Hey,
body.
How are you?
Like,
Very
look
good.
how
Nice to
fit
meet you.
and
Nice to meet
slender
you.
she is.
Dr. Nassif.
Nice
Where are
to
they gonna
meet
get
you.
the fat
Seats.
from?
So
Maybe
we
her
know
thighs?
You had a little bit of a complicated history
Huh.
of having a buttock augmentation. Before you had any buttock augmentation done at all, what were you trying to achieve exactly?
I just wanted a little bit more volume on the top.
Okay.
Because the implants looked like they were giving you a lot of lower projection.
Yeah, and I didn't really like that.
No.
I didn't need that. I had a really nice butt before I ever touched it. It's just I have body dysmorphia.
Oh!
You think you have body dysmorphia?
Oh, I know. I
Well,
do.
that's
Renee admittedly
not
has
good.
a personality disorder where she basically has concerns out of proportion to what she sees in the mirror, and nothing will make her happy. Did the doctors know you had body dysmorphia?
Yes.
Did they send you to a psychologist or psychiatrist first? They just said, okay, we'll do it?
Oh!
So, as you know, we plastic surgeons prefer not to operate on patients with body dysmorphia disorder. Of course, if a patient has a deformity,
Like she
even
does.
a patient with body dysmorphia disorder is entitled to be normalized.
Right.
But we want to go in, if it's okay, and have a look and do an examination, see what we
Perfect.
think are the options for you,
Absolutely.
and see what you think about those
There you
options.
go.
Perfect.
Her having body dysmorphia, I wonder how that's going to
Do me a
affect her
favor.
recovery.
Stand up.
If she's going to hate it,
Now, do you
and then
mind
want
if I
more,
lift
I don't
this
know.
up and
It's going to
show
be
your
hard.
buttock?
No, it's all over the internet. Go ahead.
Oh,
That
that's
is a good point.
Now, you have a big mass right here, huh? She had
Wow.
a lot of large inflammatory masses, which were consistent with
Silicone injections.
silicone injections.
Don't ever get
Yeah.
silicone
You have these old
injections!
pockets with
Oh my
scar
God.
tissue where the implants were.
If you want to do anything with
You
your ass,
have
just do a BBL.
deep
Just do a BBL.
concavity here and a lot of loose skin. Stand up for a sec. She had scarring and evidence of previous surgical procedures that had gone very wrong. Not to put too fine a point on it, but Renee's buttock has gone to
I mean, yeah.
Okay, Paul, would you?
Wow.
A buttock
Look at how
lift would
droopy
be
it
an
is.
ideal procedure to restore
Oh, but if they
normal
lift it up,
anatomy and actually
ooh.
give her a very good-looking buttock. Here's your before,
Okay.
and here's after a buttock lift,
Oh!
which to me is a normal.
It's not drooping
buttock.
anymore.
Right.
The problem we have is someone with body dysmorphia disorder is not going to necessarily be happy going from abnormal
The normal.
to a cosmetically normal situation.
Right.
That's true.
We never want to end up operating on a person for two reasons. One, if we're going to do harm, and two, if we know for sure that we're not going to make them
That's
happy.
true.
Whatever we do for Renee will not make her happy. To me, the best thing to do would be for you to get a little bit of
Therapy.
Psychological.
counseling with that, work on it,
Yeah.
get that improved, number one. Then possibly after that, maybe a possibility of doing a lift.
There you go.
Well, I will.
I also
follow
really
your
like her
instructions.
eyelashes.
I need to obviously
She has
get the psychological
beautiful
help
blue
that I
eyes.
need, and then worry
Dark
about
hair.
the
It's
cosmetic
just very
later.
striking.
Thank you guys for your time.
Thank you for coming in.
It's nice
Pleasure
meeting
meeting
you
you.
I
guys.
really want to point out that I think it is extremely responsible for these doctors to be recommending that she gets psychologically evaluated and treated first before they do the surgery. Because if they were to have agreed to the surgery, regardless, without giving her a referral to a psychologist or to a therapist, wherever it is that she needs to go, and work through this first so that she can have more realistic expectations of how her body will look and present after surgery, she would have been in a world of hurt because she would have been left to her own devices afterwards, which if she has body dysmorphia and knows that she does and has been struggling with this her whole life, she would have been left with no support system afterwards. So the fact that Dr. Dubrow and Dr. Nassif were taking the steps to make sure that she was taken care of with her mental health before they improve her physical health and appearance with her butt is really amazing. And that's something I wish more doctors would do rather than just say, oh yeah, you want surgery? Sure, I'll take your fucking money. It shows that they have a level of responsibility, that they do care about the patients that they care for.
I think I need to come to the realization that I'm not going to be perfect. And this may not give me the satisfaction that I'm looking for.
Yeah. But if you have body dysmorphia, you're never satisfied. Oh, very hipster
My name is
aesthetic
Jenn
going on
Farinet,
here.
And I have wire coming out of my nostril.
Oh! Well, that's not good. Twisted
The first
septum.
time I broke my nose, I was about 6
Aw,
years
she's a
old.
cutie.
I was going over to a friend's house and I slipped and I fell and I went smack face first onto her hardwood floor.
Oof.
I have also been a
Her
soccer
nose is
goalie my
also
entire
really
life, and
wide,
we got a lot of balls
very
in the face.
swollen.
When I was in high school, my nose became a really big issue. It wasn't a pimple that would go away. It was something that they could make fun of on a
It is
daily
really
basis.
wide.
So for my graduation gift from high school, my mom decided to let me finally get my nose done. The doctor explained to me that I had one of the most twisted septums he had ever seen, and he said that it seems like you've never taken a breath out of the right side of your nose. When the cast came off, I could immediately tell that the nose was smaller, the bridge was much smaller, and the tip was more defined. However, I had this bump on the right
yeah,
side.
it's like
and he told me
sticking
that
out.
was still swelling, but about 2
And it's
months
still
later,
there.
the bump was still there. And I took my finger and went inside my nose and realized that that was my septum. 2 years after the
Wow.
initial surgery, I decided that I wanted to go and have a revision by the same doctor.
Not by the same
The cast
doctor,
came off,
no!
And the bump was still very apparent. I noticed that I had this,
Okay, so before, like, you could see the metal that's inside her nostril there, but my god. Okay, for anyone who's thinking about getting plastic surgery or anything done in the future, whether it's for rhinoplasty, facial surgery, breast surgery, whatever, right? Whatever you want to do. If you get a fucked up surgery the first time you go in and you need a revision, do not go back to the same doctor. They will do the same job, if not worse. If your doctor you originally went to did not give you the result you wanted, do not keep going back to them. That's not what you want to do. Like, the result I wanted from my breast job, I am going to go to a different doctor for. I'm really happy with my BBL. It went great, but the breasts, I'm just not super happy with. They dropped, which I know there was a really big risk of that happening anyway. But in the future, I'm going to go and research and go to a different surgeon to give me the exact look I want to, even if I have to go to another state to do it. That's fine. It doesn't have to be here in Idaho where I live. If the result I want is in another state, I can do that. I know not everybody is able to necessarily do that, but there are plenty of rhinoplasties that can be done in other places besides going back to just the same one that you already went to. And if you know that they didn't do what you wanted and that was something as significant as her entire fucking septum is on the inside of her nose, on the other side, cutting off that airway completely, you should not be going back to that same surgeon. They're just gonna make you even worse. So, which is probably what happened.
like a wire coming out of my
Wow.
nose. I used to have a substantial amount of girlfriends,
Aw.
but over time, I've dropped them one by one, mostly because of my own insecurities. They would always get picked up, by guys because they were so pretty, and no one would do that for me. I feel this surgery would totally change my life. It would
Comparison
give me a
is the
whole new
thief of
perspective
joy.
myself and my self-confidence, and allow me to go back out into the world and be the
Right, her,
person that
I don't know why she
I
needs
am
her
on the
beanies. Her hair is
inside,
super
and let
cute.
everyone
Like, show
else
off your
finally
hair.
see
The
that.
sunglasses are adorable. But I understand when you are insecure that you don't want to be seen. You want to hide yourself as much as possible. But she needs to work on her self-confidence. She needs to see a
Okay, so this is
therapist
Jennifer.
and
She
work
had
on
a
her
hump,
sense of
Tonic
self.
tip.
Bulbous tip,
Yeah.
right? And plunging. She needs.
So I wonder if she's being.
she-
Oh,
There's
wait a
that
minute, wait a minute,
wire!
hold
What is
on.
that in the inside of her nose? This Jennifer is a very cute girl with a problem.
Yeah, there's a wire sticking
I
out of her
think
fucking
we can
nose.
fix
I think we
this.
can fix it.
Yeah.
Let's do it.
Hi, Jen. This
Ooh,
is
I love the
Dubrow
lace
and
top
Dr.
that the MA has on. I think it's an
Hi,
MA.
thanks.
Or
It's
just a
nice to
receptionist.
meet
Not
you.
100% sure.
Nice to meet
Either way,
you,
it was a
too.
very cute lace
So,
top.
how much does this bother
A lot.
you?
It really bothers me. I was teased a lot for my nose. I was called Rhino. And it's something that hurt me, has stuck with me
Let's see if we can get some Kleenex.
for my whole life.
Do you have any psychiatric history of any kind?
I have anxiety, and a lot of it does have to do with my fears of, being picked on.
I was a little bit worried because of some of these psychological aspects of her being very anxious and depressed about her nose.
Let's say you
But
had your
her
nose.
nose isn't the
Is
reason
that
for
gonna
anxiety. If she
change
has
a lot of the way you feel, or is that going to just help a little?
if she has
I
an
know
anxiety
that,
disorder,
a lot of that work has to be done internally, and
that
that's
won't
what
go
I've
away
been
with a
doing.
nose job.
But I
She
do
does need
feel that it would be one less thing
to do that
I-
self-work too.
I can go out and face the world, and people aren't going to be looking at my nose.
They're gonna be looking at her. And then she can,
let's do
it'll
this.
help her in her process to self-love and self-confidence that she needs to do.
Once you
Plastic
put your head
surgery
back
isn't gonna
for
be
me,
a magic bullet to
I'm just gonna take
a better
peek.
life. It will just make you
That's like a
cosmetically appear
Tycon. That's one
differently,
of those
right?
braided stitches.
You still have to work on
It's
yourself
extremely rare
emotionally
to
and
have
mentally.
A stitch just sticking out
What
of
the
a
f-
nostril, particularly when the nose was done so many years
There were like
ago.
2
We don't
stitches
know what
connecting
it's
her
connected
septum to her
It
nostril.
may be connected to an important structure that, when you release the stitch, may completely change the dynamic of the nose.
Wild.
Okay, but let's see that bump. Okay, so that's interesting. Breathe in and out. Okay. On this side, on your left side, you're collapsed. But on the right side, it's sticking out. So we might have to bring this side out to get your breathing better and somehow soften that. Let's put your head back. You know what that is? That is a septum wall.
When Paul put the
Wow.
scope inside Jenn's nose, you immediately saw that the septum, the cartilaginous portion that keeps the nose straight, was warped.
Ooh.
Parts of it were missing. It was a mess in there.
Sounds
But
like
the good
she's
news
gonna
is
need
that
rib.
when it's opened, we'll be able to see
She's gonna need
exactly
rib.
what's in there and be able to rearrange the tissue so that it's much more symmetrical.
Hey, if it works, it works.
I absolutely feel like it's a selfish thing for me to go through this
It's not
again,
selfish.
because I've already been through this twice. There's some people out there who never got to have like a first rhinoplasty.
But that doesn't mean
Pleasure.
just because
Pleasure
other people
meeting
haven't been able to
Pleasure
have it
meeting
that
you.
you
Nice
should
meeting
not
you.
take opportunities when they come to you. That just shows her lack of self-worth and self-confidence that she really still needs to work on herself. Because people who have a high sense of self-worth wouldn't think that way.
Babies.
Aw,
I love
baby
popping
stores!
in and out of baby stores
They're so soft, all the
sometimes.
texture,
Maybe
it's so
I'll see
cute. I don't
something
wanna have kids,
cool,
fuck
and then
that.
Eventually, I'll
But they
have
are
a
cute.
kid, and they may not make that 5 or 10 years later.
I'll be a great
So I
weird
found
aunt if my
this.
brother ever has kids, though.
If I buy it, even if I don't have a girl or a baby at all, I won't have wasted my money because it fits.
Oh my god.
That's so cute.
Seeing us
That's
styling.
adorable.
You are.
I'm gorge, right?
Yeah. That's a pretty big baby.
That's cute.
Sometimes I wonder if it'll ever actually happen for me. I want big, strong, hardy boys
For the boys.
that aren't afraid to wear pink. When I had my surgeries done, I'll feel maybe more myself. I won't feel like a product. Oh, look how cute.
The baby carriage?
That pram is adorable.
Should I have my gestational carrier have like twins? That way it's just, I'm saving time. And I
Or-
can get like a double.
I don't think you'd be able to handle 2 babies at once, though.
I'd have nannies.
Let's hope so. I can just see you pulling your hair out right about now.
I
You
want
can't choose to have twins. It just happens if it
come
happens.
off the way that I feel on the inside. Maybe that'll help me find the right man and get myself more in a position to be where I want to be in life.
We'll be back here again, I'm sure. Hopefully.
She wants to be a mom. And I love that for her. I hope she gets that. She deserves to be happy. And if she wants to be a mother, she can be a mother.
Hi.
Shopping
I'm
is
Jenny
my
Farinet.
cardio. I love that shirt.
And we'll take you back shortly.
All right.
Shopping is my
Feeling a
cardio.
little anxious. Today I'm having 3 surgeries.
That's a lot.
I'm having a revisional rhinoplasty, my breast reduced, and I'm having a labiaplasty.
That's a lot.
Like they change all the time. I can never tell if they're up or down. I know they're huge.
Even when you think they're small, they're big.
Well, I don't think they're small right now.
I know, thank God.
I can't wait till they go down a little bit.
How much smaller are you getting?
200 cc's. After
200
I have all
from
these
1,000?
surgeries and I'm fully recovered, I won't look in the mirror every day and think, what did I do to myself?
She's gonna
I have
have.
to go down gradually because if I go down too much, I'll shock myself.
200 is gonna be
and
like
you
a
know
C
me.
cup.
I'll be like, oh, and then I'll go get bigger again.
I know, and that's the last thing we want.
Right.
I don't know if she's gonna be happy with such a big difference.
Right.
I figure she may have wanted to go down to like 400, maybe 450.
My name is Ozzy.
200 from 1,000.
Okay, I'm gonna take you back.
That's a significant difference in size.
Group hug.
All right, here we go, Kimber.
Go right here.
Hope everything goes well in surgery. Fingers crossed.
Can I have my old implants back?
Yes. What do you want to do with them?
Sell them.
You want to sell them? What, on eBay?
No, my website.
Smart. She's a
Oh, really?
fucking businesswoman
Yeah,
on the
they
go.
bought my last
We love to
one.
see it.
What'd they buy them for?
5,000.
5,000?
Wow. I wish I could make 5,000 selling breast implants.
Not a bad idea.
Really fucking good.
There may be
I don't think anybody ever gives a shit about mine, but if I could sell them for
Most of
5K
them,
when I get mine taken out eventually,
Night, Kimber.
I'm
going
down.
to start by reducing Kimber's breasts from her large 1,000cc implants to a much more modest 800cc.
Oh, okay.
And Dr. Nassif is going to use skin.
I was like, what the I thought she was going down to 200 cc's. I was like, she is going to be shocked at the size difference of going from 1,000 to 200. She's going to have tiny, tiny, tiny titties. Because she's transgender and doesn't have the normal breast tissue, and her breasts are entirely dependent on the size of the implant because she doesn't have any natural breast tissue, right? So I was thinking this was going to be a failure. No. The fact that they're just reducing it by 200, putting it in an 800, which is still fucking huge. I have G-cup titties, and I have 650cc implants in addition to a lot of natural breast tissue. Like, naturally, I'm a C or a D with breasts. Before an implant. I'm already fucking big, and then I added implants in on top of that, and I'm a G cup now. So if she has 1,000 cc's, she's bigger than a G. She's probably maybe an H or more. And it's a lot. It's very much a lot. So I am curious what that's gonna be. She's probably gonna end up being about a G cup or so. With the 800cc, since she has no natural breast tissue. So it'll be a little bit of a reduction. And then she can just go down over time to maybe like 450, 500, and go down more as she wants to, if she wants to. But she seems to really like big breasts. It's part of her look.
Finally, Dr. Alter is going to reshape Kimber's vagina to give her a much more natural
Good for her.
We're doing the breast first because it's the most sterile procedure because of the silicone implants.
Okay.
You don't want to get any bacteria around those implants for fear of an infection. So these implants are so big that given time, they can easily wear their way through the skin and come out.
That's fair.
And become exposed?
Yes. Biggest problem that I might face with Kimber's breast is that her skin is very
thin.
Therefore, the blood supply to the nipple isn't very
You don't want a dead nipple.
The blood supply to the nipple is impaired. It undergoes a process called necrosis. It just dies and falls off.
Skin death.
Not a good situation. It's basically zombie breasts.
Zombie breasts.
Okay, we're gonna start by taking out these implants. Look, these implants are upside down.
They're upside down too? Oh, that sucks.
So.
Okay, again, I can't show you guys this, but wow, that is. Her boob completely went away.
Oh my goodness.
Holy
So that's
shit. It's
She's
just
basically
skin.
Skin on chest
It's
wall.
just skin. It's only skin.
So it's supposed to be like this.
It was flipped the
She
other
was
way.
like this.
Wow.
So this is also an 800cc implant that's been overinflated.
To 1,000.
Interesting. She has no
breast tissue.
No chest fat
at all.
whatsoever.
No chest fat, no breast tissue.
It's all
nothing.
implant.
Because she was formerly a man. You don't have the usual kind of coverage you do over the implant.
While Dr. Terry works on the breast, I'm going to take a piece of skin and cartilage from the ear, which will be used to line the inside of the nostrils. Essentially, that will just lower the nostrils.
Oh,
the
there
biggest
you go.
issue with
So they
Kimber's
are doing
nose
rib
is that
this
her
time.
nostrils were lifted
Huh.
up too much. You can see inside of
Right,
her nose.
you want the tip to go down.
She had tight nasal
They're going
skin.
on the very, very
So I
inside
did
of
not
the
know if I was going to be able to extend
parts
her
of
nose.
her-
So this is
the
the
swirly
composite
portion of your
graft.
ear.
It's made out of skin on this side, cartilage on this
Gotcha.
side. And this will
Again,
be used
can't
to
show you any
align
of
the
this.
inside of her
That's really
nostrils.
interesting.
What are you doing now?
I took a composite graft from the left ear.
Because her skin is so thin, and it shows what we call rippling through the skin, where you can actually see the folds of the implant.
Yeah.
We're going to sew in a piece of mesh to reinforce the skin.
Very smart, so that it won't show the rippling and it'll appear smooth and more natural. That's a really good idea on Dr. Dubrow's part to prevent rippling.
Let me have a rag now.
All right, can we sit her up?
No.
Yeah.
Paul, look at the rippling here.
They look remarkable.
Wow.
You did an amazing job.
Thank you. With
That looks
time, tissue
really,
will grow
really
in
good.
and thicken up
There's
the
still big
skin
boobs,
and
which is
make
what she
these
wants.
Better, safer breasts.
Big boobies.
to have. I think
But
they're
no rippling.
smaller, They're reinforced.
And they're safer.
They're safer. She should be really happy.
And now we're trying to lengthen
4-hour
Kimber's
surgery.
nose through a closed technique. I'm going
Huh.
through a lot of scar tissue.
That is a lot of scar tissue.
You know, since
Very
I
bloody.
wasn't doing a lot of work up in the middle part of the nose or around the tip, I did not have to do an open rhinoplasty.
Wow.
Which means only the incisions are made inside the nose.
Ah.
There's no visible external scar right here.
Right here
Dr.
for it.
Alter,
That's
how's
really
it
good
going
that they
down
don't have to have a scar be there for
Going
her.
great.
That's awesome.
Kimber's clitoris had too much of her clitoris showing.
Okay, they're about 5 hours in.
So I extended the length of her clitoral hood.
Nice.
So that it covered more of her clitoris, which will make her look much more normal.
Very nice.
She'll still be able to get access, so it's not going to interfere at all with sensation.
Excellent.
Okay, guys,
but it will look
we're
more
finished.
natural, which is
We're
what
able
she
to
wanted.
Lower her nose about 5 millimeters, lower her nostrils. This is going to be exactly what she
I'm
wanted.
very interested
It
in
looks
seeing
great.
her recovery
All right,
and
guys,
how
thank
it
you.
looks
Put a little
after
cast
her
on and
aftercare.
tape it up and we're all set.
In Kimber's situation,
Ooh.
I was able to improve and lengthen her nostrils, but by no means are they perfectly symmetric.
Okay, Dr. Alter, how you doing over there?
Just about done.
Nice.
I finished the clitoral hood. I'm just about done with her
And he's
inner
doing her inner lips.
She's got much better definition of her labia minora.
Which is her
she's gonna
inner
look
labia.
much more normal, and she's going to be much more confident about her
Good for
appearance.
her.
So I'm very happy. I think she looks fantastic.
Well, that's why we had you. You are the best, my friend.
Well, thank you, Paul, as are you.
The vagina
Well, thank you.
whisperer.
Well, thank you.
I wonder if he's still performing surgeries, because this was back in like 2014 when season 1 of Botched came out. 10 years ago. I would hope he still is, because he has 10 more years of experience.
And I'm about to get my nose cut open and filleted like a really nice piece of veal. Isn't that sexy?
A nice piece of veal, huh? Don't eat veal. Don't eat baby cows.
You'll be fine.
I'm very anxious about the idea of having to have a third surgery because I don't want to go
Jenn
through
Farinet.
the whole process to possibly not fix something that has really made me very unhappy.
Jennifer?
Yes?
Hi.
Hi.
I'm Diana. I'm going to be bringing you back.
All right.
Okay, great.
Ready for it?
Yeah.
All right.
I'll see
She
you
has a
tomorrow.
really fucked up
when you get
nose, so I'm curious how much of an improvement they're going to be able to get. I don't think it's going to be a home run, but if it can at least be an improvement, that's
Do you have any
better than
questions?
nothing.
No? And
very scared about
we're
the
going to take
anesthesia.
really good care of you, okay?
Oh, I love her tattoos on her
Promise, Dr.
arm. I
Nassif
want to
does
get a
this all the
Pokemon
time.
sleeve
He's the
on
best.
First thing
my
right
left
now,
arm here.
Open up the nose, check out that septum to see.
When I'm not poor.
You know, how much cartilage is there.
Gotta see what
I
that
love
suture's
Pokemon.
attached
Oh,
to
that's
also.
right. That suture has to come out.
Yeah, the suture inside of her nose. And of course, she's having anxiety right before the surgery. A lot of people are
Take them off.
really anxious when it comes to surgery. I've never had that problem
that's
personally
gonna
because I
be
don't
the
suffer from
draw.
anxiety.
So let's be honest, this case could be a total disaster.
But that doesn't
doesn't
mean
matter, I'm
that
ready
people
for
who
it
do
no matter
suffer
what.
from anxiety's feelings are
We're
any
doing
less
a
valid.
revision rhinoplasty for Jen. We're going to use cartilage from her ear and tissue from her scalp to strengthen and straighten her septum and make her nose look more symmetric.
Nice.
And hopefully, all this work will help improve her breathing as well.
Okay.
Give me a tonsil.
Huh. So they don't even have to
So, at
get
this
ripped from her,
point-
which is wild.
I'm going to be taking out the fascia and soft tissue which lies on top of the chewing muscle.
Ah, okay. Again,
We'll use
blurred. We
that
can't show you
tissue
guys any
to
of this.
Cover the tip of the nose.
That is a
Okay, let's
really
start the
squishy,
rhinoplasty.
dangly
Then
piece of
just make
tissue
the
that they can
incision.
use
Just-
for
let's make a small one right
construction. And they are doing an open rhinoplasty on her.
there. Look at. Look. Give me a pickup. I mean, here's that little stitch that Dr. Dubrow
Oh.
saw underneath the skin. The next step would be to approach the septum.
Wow.
The septum is made out of cartilage and bone, and it's in between the two nostrils, and it divides the left from the right
Right.
side.
The septum is severely deviated. It's like a big L.
Wow, it
That's
should
gonna
be
our next
straight.
challenge.
It's not even curved to
And
the
so
side,
this
it's
thing
just
is-
at a
it's
90-degree
completely
angle.
Devastated.
Holy
it's in
shit.
the top 10 of the worst deviated septums that I've
Wow.
seen.
What the heck did you do?
But he can fix it, because he's Dr. Nassif.
It's completely devastated. This has already been scored. Look at.
The septum is in the top 10 of the worst deviated septums that I've seen.
It looks good. This is why
Wow.
I teach. Now I'm going to go to the ear, take some cartilage, and we're going to rock and roll and finish this up. This is the ear cartilage that's being removed.
Very,
We're gonna
very
use
cool.
a nice piece of that to help reconstruct the
Yeah,
nose.
they took a good chunk of it
After
from
I
the
fixed
swirly
Jen's
parts of her inner
septum,
ear.
ended up taking down the rest of the hump, and then with those bones still wide open after I took down the hump, I had to bring those bones.
Yeah, shave it.
So to close that gap, we have to fracture the bones or break the bones.
Oh, he's gonna do
to
the
bring them
mallet
together.
again. Here we go. Mallet.
Go. Okay,
Fracture the
hold on.
bones.
Let me see the little pieces of fascia that we have. Oh, good. That's perfect for the tip. We do need to put a smidgen of cartilage right here and here. And the profile right over that middle vault
Yeah.
there just needs to be taped down a little bit, but it's
That
beautiful.
tip looks amazing.
That's a gorgeous, gorgeous
And that looks
angle.
really
I'm an
good.
extreme perfectionist. I'll just keep going
You can just like shave it down a little bit on the bridge,
Okay, guys,
and
great
it'll be
job. She looks fantastic.
a perfect swoop.
I'll see her in recovery. Jen better be happy because her nose turned out fantastic.
It looked really
She's gonna be
good.
able to
It looked
breathe
really
well.
good in that picture.
It's gonna look good. She's gonna be ecstatic.
I hope she's happy with it. Fingers crossed! Ooh, recovery. Kimber day 1.
I'm a bit surprised how sore I am.
Well, yeah, you had 3
Even
surgeries.
After I had a sex change, I was at the mall getting my hair and nails done 3 days later.
Which you shouldn't be doing.
I can't even imagine doing any of those right now. Hi.
We're here.
Hi.
How are you?
Thank you.
Good. How are you?
Sore.
Sore. Understandable.
So
Where?
My breasts are still sore.
There, sir. Well, let me tell you what I did. I started on the right, and I went down to the implant. The first thing I found was the implant was upside down.
No bueno.
I kid you not. Completely
It flipped.
upside down. It flipped. Yeah. You had 800 cc salines overfilled to over 1,000.
Damn.
Yeah. With the right one upside down. Yeah.
I knew something was up.
Yeah. Just want to see a quick look at my incisions to make. See this mark? That's where I sewed in the mesh.
I can't see anything.
You obviously are not bleeding. Everything's looking okay.
Okay.
All right?
Everything,
Good.
thank goodness, looks absolutely perfect. And you look great.
Aw.
She wanted a more natural look, and I think we did
I'm
it.
excited to
I
see
have
her
something for
post-operative. Heal.
They're clean and intact.
I'm thinking about sending them to my ex-boyfriend that wanted me to get them that large and say, you like these better than I did, so you can have them.
Yeah, f
See you very
him.
soon, okay?
Absolutely,
Goodbye.
Kimber. Stay toxic, bitch. Always. Burr, 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 burr.
I'm loopy.
She's on pain meds.
Don't say.
Yeah, I do.
I've never seen Jen this out of it.
Staples are only supposed to hold together paper, not heads. Like I'm flying around, floating around like a balloon.
Like a balloon.
Just what's up? Yeah. There we go.
All right.
You look like you're ready to walk the red carpet.
Green sexy.
I look like a wet poodle.
She has a really good
Hello.
Good morning.
personality
Good
outside of
morning.
surgery, which is
How you
really
doing?
important for recovery.
I'm doing, you know.
Okay, let me just look at your nose. So you're gonna take your hydrogen peroxide and you're gonna clean like this, all the way up, especially here. Your deviated septum,
Uh-huh.
it was
Yeah,
bad.
it was really bad.
With me doing my little magic,
Uh-huh.
I got it like that.
Wow.
Brought the bones in, brought the hump back, got the nose more symmetric, got your breathing better, got that septum
Good
straight.
for her.
Oh my gosh. I'm so looking forward to be able to breathe out of my nose.
That's
finally,
gonna be
so
nice.
I'm no longer one of those awful mouth breathers. I'm so glad that I came to see you. My mother and I had looked into coming to see you actually about 4 years
Wow.
ago. And the thing was, we just couldn't come up with the finances to do it at that point. I'm feeling more okay with me in my own skin, and I know that this, you know, has
Aw.
gone well, and I just feel positive about it.
That's what makes me feel good about what I do. Just today, compared to when I met you for your consult, I'm already seeing more happiness and a positive
Which is
vibe right now.
really
I
the
love
whole
hearing that
point of
you're
having the surgery
feeling
is you're
a lot better.
happier with
What I'm
yourself.
most excited
You're doing it
about
for you and for
is
nobody else.
Not really Jen's nose. It sounds like this is hopefully the beginning of a new start.
Aw.
All right, let me walk you up to the front.
Okay.
Well, it sounds like it went really well, so now we get to see the final results, which is gonna be exciting. I really want to see how Kimber's aftercare went for her surgery. Lingerie. Jen.
Miss
Okay.
Jennifer.
Hello.
So we're
you
gonna
feeling?
see the nose a weekend.
I'm a little bit anxious about seeing what's under the cast.
And
Again,
here
can't show
comes-
that.
here comes
There
it.
goes the
It's
stint.
out.
Oh gosh, she can breathe.
Oh my god, I can breathe. Are you kidding?
Aww. The instant reaction she had of being able to
It's
breathe
holy
for the first
balls.
time.
It's beyond holy balls. It's like holy
Holy shit,
I've
indeed.
never been able to breathe like that before, ever.
Aww.
It's like night and day.
That's what makes me excited about what I do.
You don't
She can
see
breathe.
reaction like that all the time. That's what takes everything you do and makes it all say, this is really
That's
worth
awesome.
it. It's especially nice when you make a dream come true.
All right, but is
I mean,
the
you already
septum
did your
straight?
side. I mean, this is pretty much.
I'm trying not to get my hopes up. The first 2 times, like, it wasn't.
It
what
looks
I
a lot
wanted.
better.
Here, take a look.
Looks a lot better.
Oh my god, Dr. Nassif, I look like a totally different person.
Aw, he's tearing up
I'm
too.
not used to this much emotion.
It wasn't my goal to make Dr. Nassif cry, but it touched me that it touched him.
Aww. Obviously, they're not gonna give us like a great look at it until the
Mine,
reveal.
And this is on my face. Like, it's completely
Good
overwhelming.
for her. Good for her.
I saw her at her worst, so I'm excited to see what she looks like now.
We finally get the
Haven't seen Joe at the
reveal.
cast off yet, so the entire thing's a mystery at this point. But I haven't come 3,000 miles. You must be the most
Was that her
excited.
mom?
I am the most excited.
Ah, it
Words can't describe it. It's been
Her
a
mom
while
looks like
waiting
she's
for this
had some
moment.
plastic surgery on her nose too that didn't end up very good. Ooh, look at that sexy red dress. Hell yeah, fucking tattoos everywhere. Oh, woman on the go. Toned legs. Oh, damn, she looks good. Holy shit. The nose, the profile, her profile.
Oh,
So good.
unbelievable.
I'm so happy.
Wow.
I'm so happy for you. And it keeps getting smaller every day.
Right, the
I'm
swelling
like
goes
reverse
down.
Pinocchio.
Looks
good thing to
so
be.
good.
I mean, honestly, have you ever seen me get dressed up like? Nobody would ever stop me on the street and say, "Hey, did you get your nose done?" No one's ever gonna be able to.
Wow,
know.
look at the
It's like
difference.
a whole.
You can see that this is straight and pretty symmetric between her two eyes on both sides, whereas this one, when they were doing the turnaround, you can see it's moved over here to the right. It has like an indent right here at the tip that then pinches and makes the tip go up.
Whole new chapter, like
Wow.
not even new chapter, new book. Let's get rid of the old one. We'll get a new one, and like today is day one. Now I have to go out like every night and find myself some more friends.
No, you don't have to go out.
I don't have to, but I could now. I have the option.
She does. She has her options open.
Exactly.
This is especially wonderful because it makes you feel different and good about yourself.
Exactly.
And that's all that matters.
Mama's right.
It would be
That is what
almost
matters.
rude not to let people see how awesome this is. I'm thrilled. I feel great, and I look
In fact,
great.
she's so much more
The new
confident
and
now is
improved
great.
Jenn.
I love it.
I know.
I love it. I want one.
You already have one. Let's not get greedy here, people.
No, but it does seem like her mom wants the nose surgery too. But that was a really good result. I loved that. Dr. Nassif did a great job. I really want to see Kimber though. 3 weeks after, her boobs look good. The cleavage is nice.
Over the last 3 weeks, the doctors have been keeping a very close eye on me. I've been seeing them all weekly.
Nice.
Dr. Dubrow probably more than weekly, but maybe I spend a little bit more time there than I need to. But
Hi, Kimber.
That's
How
funny.
are you?
I'm good.
Hi, Kimber.
Hello.
Why is she spending so much time with Dr.
So I'm gonna
Dubrow?
take off the tape.
Is there something wrong with her breasts? They aren't telling us?
Okay. All right, so your tip is not bad at all. Okay, I don't see much swelling.
Huh.
All right, so we drop your tip
Very straight.
about 5 millimeters, by the way.
You nailed it.
Wow, it is much more down.
Thank you,
It's
thank
no
you.
longer a pig nose
Overall,
looking up
the
into her
profile,
nostrils.
The tip looks perfect.
They exceeded expectations. Before my nose surgery,
Wow,
my
look
nose
at
was flat
the
again.
profile here. So just like he said, he dropped it 5 millimeters. Look how big of a difference 5 millimeters made. So it was very upturned, like I said, very see up her nostrils, kind of piggish. And they dropped it. She still has a beautiful slope. It's a little more straight. This one, what you could see was more curved, like a C shape or a crescent moon. Whereas this one is a much more softer angle of her bridge going down. And the projection of her tip is tipped down as well. So you can't see up into her nostrils. It's just the normal, nostril appearance that you can see. Looks significantly better.
That's my face, and you could see straight up my nostrils. And now my nose is perfect, and you can't see my brains.
I don't know why she was like twitching her lip there for a little bit. That was a little weird.
At my nostrils.
See that lip twitch there?
And now my nose is...
I don't know what that was. Maybe she had filler and it was messing with her lip, specifically right here because it's twitching. I'm glad, is happy with her results, and it is significantly improved from this look over here to the one that she has currently. But her nostrils are 2 different sizes. You can see that that's her left. You see that her left nostril is higher than her left nostril, which is lower, right? So it's a little tilted, but as long as she's happy with it, and this is already an improvement from what it was before, that's what matters.
Perfect. And you can't see my brains.
How do your breasts feel?
They don't hurt.
Boy, they're so much better, smaller like this, aren't
So
they?
much better.
They look really good.
So much better, yeah.
I feel like myself again.
Really?
Yeah, I don't feel like a character anymore. Before,
Wow!
my breasts were ridiculous.
They were very big. I mean, they're still big. Let's not beat around the bush. 800cc is still a lot of fucking breasts. However, you can see that her left breast was tight and high, and that her right breast was lower than the other one. So not only were they asymmetric, but they also were appearing to be two different sizes too. Her right breast seems bigger and wider than her left one, which seems like it had kind of sucked in a little bit, maybe for because of the way that the implant was positioned inside. It's just that they're not only two different sizes, but they're also in two different positions and very asymmetric. And of course the rippling and whatnot as well. But on the right side here, you can see that they are symmetric. They are the same size. They don't have any symastia in the middle or anything like that. Not that she had any before, but they look really, really good. There's no rippling that you can really see. I'm sure that her areola scars are probably recovering fine. Of course, we can't see them because we aren't allowed to see her areolas or nipples. But it looks great. It looks a lot better.
They didn't move. Now they're the perfect size, 32 triple D.
So she's an F cup now.
Ideally,
she's
these
an
are
F
still a
cup,
little
triple
big.
D.
I think for right now, the stage in my life, they're good.
They're perfect.
But I definitely see myself going down in a couple years to probably like a D.
Kimber looks fantastic.
He is
She
good.
was hoping
He
for
is
a more
good.
natural looking result, and I think what we've done will go a long way towards achieving that goal.
Yeah.
Okay, so I need to see you in stirrups, okay?
Ooh, those really cute heels
My
though.
vagina is looking gorgeous.
Good, she loves it.
Gave you more of a convexity here instead of a concavity. See, there's your clitoris in there. This is going to continue to soften up and become even more natural looking.
Wow!
My vagina probably was able to heal so quickly because it's used to the pounding. You did amazing. Everything I wanted, I got.
No, thank you.
I mean, maybe the sex
Like,
helped.
less pornified. I did
High
it
hard, huh?
myself.
High hard, scene 3 beta, take 2.
I'm
High hard
definitely
porn star.
ready to
Ba-bam.
exit porn. So after this last video I'm in, I just want to be done. Do you like everything?
Yeah.
My threesome of doctors properly gangbanged me and gave me just a perfect outcome.
You know the producers were like, I want you to, because you're a porn star, I want you to say this in the most porny way possible, so that I can put it on television. And she was like, okay, I'll just say the gangbang me. Like, you could tell that was production feeding her that line and telling her to say that, because I don't think she would say that on her own. But it fits in with the, whole story that they were doing of this time.
I'm happy.
She looks really, really good though. What's the next episode?
Look like how?
Oh, those were some very droopy breasts.
I just can't believe.
Okay, and we're not gonna watch the other one here. That's gonna be for another time. But let's go ahead and talk about what we just saw, everybody. That was Vagina Bomb, and I am very happy that Kimber was able to get the results that she wanted to. I'm glad that the doctors gave her a little bit of guidance in the fact that it was like, hey, you need to get yourself in a more realistic mindset. You're not going to be more virginal looking when you have this labiaplasty. We can improve it. We can give you a clitoral hood. We can help you with your inner labia, but it's not going to be what you're wanting to do. The whole flashing with the friend of the vagina was very inappropriate, and I think was dumb and completely done for television. I would hope that they wouldn't do that in an actual doctor setting if they weren't being filmed and on TV, but who knows. I'm glad that Jenn was able to get her nose fixed, because she was immediately confident levels through the roof afterwards, which is really what you want to see. That's the whole point of getting cosmetic surgery, is because you want to be happier and more in line physically with how you view yourself, right? And the fact that they told the person with the flipping butt implants to go get psychological help first before they would be willing to do surgery on her just shows that they really do care about their patients, which I think is really nice and shows a high level of professionalism. Because more people need to be told, hey, you really need to work on yourself first mentally before we're going to do something that we know you're not going to be happy with, that will only end up damaging you more in the long run, because you don't have the tools you need to cope afterwards with it. So really, all in all, a great episode. I am very happy with this one. I'm excited to see what we're going to be doing next on the next episode of Botched. But if you guys don't want to miss that, and if you haven't already, go ahead and click the like button and subscribe, because not only does it taste delicious, but it helps us out here for growing on YouTube tremendously. And like the video too if you guys enjoyed this one. If you didn't see my other episodes of Botched, again, eye icon in the top right hand corner. You guys can go back and watch those. I will try and add another series to this channel as well, so we're not just watching Botched. I just have to work it into my schedule, because I also stream 3 days a week on Kick, which the link will be in the description down below if you guys haven't already seen me and want to interact with me live over there Monday, Wednesday, Friday from 4 p.m. to 7 p.m. Mountain Standard Time. You can. But for now, I appreciate all you guys coming in. Let me know your thoughts on this episode in the comments section down below. And without taking up any more of y'all's time, I'll go ahead and let you beautiful people go. Goodbye, my lovelies.